Lovely. So hello, everyone, and greetings from the southern tip of Africa. I'm sitting in my office at the University of Cape Town. And, you know, the first thing is I would much have preferred us all being in a room together and talking about these very important and interesting issues. But I guess the one good thing that has come with COVID is we've learned that we can actually have meetings like this with people all over the world and in different cities and in different settings, joining meetings like this. So I'm very happy that I was able to sit here and listen to all the very interesting presentations so far. And sleep is such an interesting, such a fascinating phenomenon, isn't it? It gives us a lot of pleasure if we sleep well. And as we've heard already, it can give us lots of challenges and stress and distress if we don't sleep so well. Stacey asked me to talk about sleep in the context of TAND and the Tandem project. And so what I'm going to do is, in a way, zoom out from the conversations that we've had so far. In case your brain feels a little bit full, I'm not going to present any real data. So I'm just going to try and tell you a basic story about TSC and about TAND and Tandem. And so the only task that you have for the next 20 minutes or so is to differentiate these four terms or keywords that I'm going to talk about. The first one is TAND. Second is TAND levels. The third is TAND clusters. And the fourth is Tandem. So I am going to try my best to make it very easy for all of you. And I was enjoying listening to Caroline saying how long she's been doing behavioral and TSC research, and Stacey. And so I thought, well, if they're going to give numbers, I should give numbers too. I started working in the TSC community in 1997. So this is my 24th year working in the TSC community. And every day and every week and every month and every year, I learn new things from people who live with TSC, from their caregivers, and from people who support them. So I'm sure we are all going to learn more things today. So let me start this first bit of the story of those four words that I want you just to be able to take away with you today. And the first story is therefore the one of TAND. And as you know very well, TAND stands for TSC-associated neuropsychiatric disorders. And you might ask, well, why did we decide to create this term TAND? And in a way, there were two obvious reasons. The first one was that through research that we've done and that many other people have done, we know that the majority of people, more than 90% of people who live with TSC, have some biopsychosocial difficulties, so neurodevelopmental, mental health, etc. difficulties. But that fewer than 20% actually at any point in their lives ever receive any diagnosis or treatment. And that's a major challenge because it means the kind of needs gap, the identification and treatment gap is vast. At least 70% of people almost never get access to an appropriate formulation, even though we know most of the components of these dilemmas can be treated and there are evidence-informed treatments for them. So that was the main story, this huge need, this gap that people were getting better and better at identifying and diagnosing TSC and the physical features of TSC, the kidney problems, the epilepsy, the skin, etc. Wonderful progress has been made, but these other things have really lagged behind. And we wanted to find a simple way, therefore, to almost put the spotlight on that. The second reason why we decided to create the concept or the term TAND was that there was significant confusion about terminologies, about the language people use in the global community. And I'm going to just show you some examples. So here are some of the terms you probably use and have heard and that people have used, talking about cognitive issues or behavioral problems or neurocognitive or neurobehavioral or neuropsychological or psychiatric or mental health problems or neurodevelopmental disorders or learning difficulties, intellectual, and the old terms that fortunately people are hopefully not using anymore. But you can see these terms are confusing because they may mean different things to different people. They might mean the same thing to different people. And so as a kind of a neuropsychiatric group, we decided we wanted to find a solution. And when the 2012 International Consensus Conference came together, we were almost 80 experts from all over the world. The neuropsychiatry panel, which I chaired, we decided we want to coin this new term, TAND, and we agreed to help people differentiate between the different components of TAND, and we call them TAND levels. So I'm now going to show you the 6 levels of TAND, created in a way to make it easier and clearer for people to have a shared language when we talk about these difficulties. So the first, so you've heard about TAND already. Now the second keyword, TAND levels. So the first of the TAND levels is the behavioral level. And we use that term simply to mean that any observed or described behavior. People with TSC can have all sorts of behavioral difficulties. Here you can see some of them. People can have aggression, temper tantrums, or anxiety, or depressed mood, or self-injury, or overactive and impulsive behavior that you've already heard about this morning. And of course, they can have sleep problems. So this is a level where simply we observe behavioral challenges at any or many of these different levels. And so that is a TAND behavioral concern. And these are the reasons why mums and dads and families come to clinics to say, my child is struggling with, my son or daughter is struggling with, I am struggling with one of these things. The next level of TAND then is the psychiatric level. So now we're going to decide, we're going to use diagnostic systems like the DSM, the American system, or the ICD, the International WHO system, to say, do different behaviors and signs and symptoms fit together to meet criteria for a particular disorder? So for instance, somebody who might have language delay and poor eye contact and repetitive behaviors may or may not meet criteria for autism or an autism spectrum disorder. Or somebody who might have hyperactive and impulsive behaviors may or may not meet criteria for ADHD, for which there are treatments. And similarly, some people might have sleep problems that you've heard about today, and they may or may not meet criteria as we look technically as doctors when we diagnose things. They may or may not meet criteria for a sleep disorder, as you heard from Kathy this morning. And so we differentiated between these two levels to make it clear that to help people understand, you can have some difficulties without having a disorder. You can be anxious without having an anxiety disorder, or you might actually have anxiety and a disorder that requires diagnosis and treatment. The third level, which is different but very related, and you've already heard about that too, is the intellectual level. This is when we're going to measure the intellectual ability using IQ type tests and so on in people. And we know in TSC that almost half of people have some degree of intellectual disability, but even those who have normal intellectual ability tend to have very uneven profiles of strengths and weaknesses. So many people with TSC have some areas of particular ability and some real gaps in some of their intellectual abilities. And that's very important to know as a separate level, but we also know that it links and it associates in some way with some, but not all, of the other levels. The fourth level is the academic level. So this is where we're going to think about how people do in terms of reading, writing, spelling, maths in school, scholastic kinds of skills. Again, it's very closely linked to this level and some of the others, but it's a distinct level that requires its own identification, that requires its own interventions. And usually, very often, these kinds of interventions are done through the school systems, through educational psychologists, and through those sorts of programs. The fifth level that we described is the neuropsychological level. This is when we're now going to think about the brain skills in kind of a brain referenced way. So we're going to say that there are different parts of the brain that specialize to do particular neuropsychological functions. And in TSC, most people will have difficulties with some of their neuropsychological skills, even if they may have a completely normal or a super high IQ. Many people with TSC struggle with sustaining their attention, with doing two things at the same time, dual tasking, with switching from one thing to another, with recall of their memory, with spatial working memory, so where things are in space, and with cognitive flexibility, getting stuck, and that's often seen as being very inflexible too. And these two can cause a lot of challenges in daily life and can also, of course, have a significant impact on academic skills and on occupation and on getting on with jobs and so on. The last level, the sixth level of TAN that we described, is what we call the psychosocial level. And this is the level where we think about the impact of TSC and other TAN levels on the well-being, the self-esteem, the sense of being able to do things, on parental caregiver stress, on relationship difficulties. And we felt it was important to add this level because so often health services, caring professionals focus on all the kind of basic things, the physical things, the disorders, the challenges. And we don't stop to think about how is this affecting you as a person? How is this affecting the family who has to live with and deal with all these difficulties? And so these are the 6 levels of TAN that we described. To go alongside this definition and description of terms of TAN, people in the TSC community said to us, can you please help give us a simple tool that we can use as healthcare providers, as people who are supporting families, to identify these things? And so we created this thing called the TAN checklist. We published it in 2015. It's freely available. I'll give you another link to that in a minute. And it's a simple checklist that just says, has there been any concern about these things at any point in the past? And you will see, if I look at the third item 3, asks about the behavioral level. Do you remember I've just shown you the behavioral level of TAN? And it just says, has there ever been a problem? And then lists all the kind of high frequency challenges that we see in tuberous sclerosis. And here you can see the last one, sleep difficulties, such as falling asleep or waking. Just one item about sleep, but we wanted to make sure that there's something about sleep because it, as you've heard, is so fundamental in terms of its impact on people's lives. We took the checklist and our findings to people in the TSC community. And here you see a lovely picture of some of the members of Tuberous Sclerosis International. This is a TSCI, for those who don't know about TSCI, you can Google them as well, they have a website, is an international organization or group of professionals, researchers, caregivers, people with TSC. Some of them are people with TSC who are caregivers, who are also professionals and researchers. So it's a real community of practice. And we've been working with TSCI very closely along all these TAN-related issues. And when we took what we've done so far to people in the TSC community, they said to us, these things are all very helpful to us, but TAN is so overwhelming that it still makes it hard for us as caregivers to know what to do. And in fact, healthcare providers said to us, it's so overwhelming, we don't know what to do. And very often what then happened is that people simply ignored. They just didn't want to ask about TAN. Pediatric neurologists and physicians would ask about the seizures and the kidneys and so on, but they would try to avoid asking about TAN because they didn't know how then to manage this overwhelming uniqueness. And that was the reason why we then thought, could we find natural TAN clusters of difficulties? So a cluster in this sense means of all those TAN things that you've seen on that umbrella, are these things just random occurrences? Does everyone just have their own random pattern? Or might there be, if we use some clever statistical methods, might there be natural groupings of some of these TAN features that might make it easier for us as caregivers and people who live with TSC to separate, to say, I have this group or that group of difficulties? And might that also then make it easier for doctors, for researchers and others to say, there are these natural groupings of tanned features that maybe might help make it easier for us to identify, to come up with treatments, to do parent training and support, and that might help us do better research in a more targeted way. And that led to the process of looking for and finding natural tan clusters. This is just a slide to show, firstly, Lauren Ecclesio, who's a PhD student with me here in Cape Town, did the first kind of feasibility study, and then in the Tosca study, you've heard about the Tosca, big international study, we then did a slightly bigger investigation. And finally, in just almost 500 people across the world, we did cluster work, and we found that we could identify 7 natural clusters. So these are taking some of those items from the tanned level umbrella, putting them using data-driven techniques and methodologies, 7 natural groupings that we hadn't identified and that nobody had really seen before. And one of the groups is kind of overactive, impulsive behaviors. You've heard about them already this morning. Another clear group is about reading, writing, spelling, math, kind of scholastic difficulties. A third group of things that clearly cluster together are these neuropsychological deficits that I've mentioned to you. And you can see these are now starting to overlap a little bit more with some and one another. There's a clear group also for mood, anxiety, depression symptoms. There's a separate group for dysregulated behaviors, aggression, tantrum, self-injurious behavior. There's an autism-like cluster, but you can see the autism-like one also cross-talks to lots of other things. And we have found a distinct eating and sleeping cluster. Now you might ask, well, why does eating and sleeping cluster together? Surely they don't always go together. And you're absolutely right. This picture is called the dendrogram. So it's like a tree or a family tree, if you imagine a family tree of different tanned features. And here you can see that eating and sleeping kind of grouped together. How this technique works that we used is called hierarchical cluster analysis. And so the first thing, all the data are in a pot. And the first thing that this does is to say, which of these are the closest linked to one another? And then once they're linked, such as we see with eating and sleeping, we then say, okay, what do they link with next? And so in a way, it's important for us to know, it doesn't mean that we're saying eating and sleeping always go together, but they are the most closely, the most commonly linked. And once they are linked, they actually talk to lots of other clusters, but they are their own distinct cluster. And I think from a clinical point of view, what that tells us is eating and sleeping difficulties are common, and they may be associated with many other TAN clusters, and therefore there may be many different pathways to eating and to sleeping. If today we're talking about sleeping specifically, there may be many different pathways and meanings or functions or associations to sleep difficulties in TSC. So we went back to the TSC community and said to them, here you go, we've found these clusters. What should we do now? What do you make of it? And people said to us, well, that's very interesting, but the previous checklist you made was really for clinicians. Can you do one that we can fill in ourselves? And also, can you do it in a way that we can not just say, has it ever been a problem, but we can say how much of a problem it is now. So to quantify it and to give a current version as well. And number 2, while you're at it, can you please put it in an app so that we can do it on our smartphones or on a tablet so we don't have to fill in a form always? And number 3, can you please give us some tools and tips and things we can do, not just that we should go and seek a professional to get diagnosis and treatment. And that brings us to my key word for Tandem. Tandem is a research project that we've set up to try and answer exactly these questions that people in the TSC community have asked us. And so with funding from the King Bodewijn Foundation, so Belgian Foundation, the Tuberous Sclerosis Association in the UK, we set up this project with 3 main aims. In the first aim, we agreed that we make the self-complete version of the TAN checklist. We will put it into an app, and then we will make sure we'll check it against expert data. In the second aim, we said, apart from just giving you a tool to identify problems, we're going to bring a consensus group of experts together, look at the literature, have consensus, build those consensus information into a toolkit that families can use and build that into the app as well. And then the third aim is we're realizing that there's actually a small community of people who do TAND research, and therefore we wanted to expand that, to expand knowledge about TAND in the global community. So we have a lovely team of people, I'll just go very quickly, of different groups. Stacey, in fact, that you've heard, leads the Eating Sleeping Cluster group and has done some great work with us over the last almost 2 years now. Very importantly, we have family members, people who live with TSC as part of the project. We take no step without making sure that families are part of it. And so aim 1, just to illustrate to you the same page that I showed earlier, in the TAND SQ, apart from asking about the particular behavior, for instance, we then say how much of a problem has it been, and people can rate it on a scale of 1 to 10. And here you can just see sort of what it would look like in a paper version. So it's self-completed, it's quantified. And what we next have started to do is to develop the app. And here you can see roughly what the app will look like. You'll log in, there'll be all sorts of bits about yourself and the family and your TSC story and checklists that you can do. And this is what it'll look like. You'll just fill it in on the app, go to the next page. And at the end, it will actually show you your child or the family member or the person you're filling it in about their cluster profile. Aim 2, I've said we need to build consensus, and so we're doing it through various steps. 1 was to do a scoping review, and I'll say 2 words about that in a moment. Then for the expert clusters to do a deep dive review of all the evidence about each cluster, and then we brought all of that together to come up with a consensus. And just to say a word about the scoping review. A scoping review is a particular research approach to get a big picture of the landscape. Nobody had ever looked at all research that had been done in TAND ever. And that's what Stacey and Stephanie, who unfortunately can't join today, they did this huge task of looking for all papers ever written about TSC, about TAND in TSC. And then we had 10 key questions. I'm not going to show them all. I will just give you an example of some of the findings that we got. The methodology, I'm not going to tell you about that. Or just to say, Stacey and Stephanie had to start with thousands of possible articles to narrow it down to, in the end, 230 papers that were related to TAND in the literature. And so here are just a few of the findings. So one question we wanted to know is how much TAND research has been done over the years. And here you can see clearly, first papers we could find 1987, a nice steady increase. And we were very pleased to see that since we coined the term TAND, which was in 2012, you can see a lot of research has actually happened. Now, we can't say it's because of the coining of the term, but it's encouraging that there's growing research in TAND. The second question we had was, where in the world has TAND research been done? And here you can see, if I show you the map, well, on the good thing, Canada, US, UK, some European countries, a few other places. But the downside of the finding was that there are still many countries in the world where there's been no or very, very little TAND research. And so we have a task to think, how can we make more representation of TAND research? How can we be more representative of the cultural and the linguistic diversity of people who live with TSC all over the world? Another one was, I've introduced you now to the term TAND levels. We wanted to know which levels have been investigated. And you can see behavioral level, psychiatric, intellectual, relatively well, but you can see the psychosocial, the neuropsychological, and the academic levels. We still haven't had that much research at those levels. One thing I was particularly interested in, and you will now see I remain concerned about, is how many intervention studies have been done. A lot of TAND research has been descriptive, describing, identifying, looking at correlations and associations. But when we looked, and I'm just going to point out here, at group studies of groups of people with TSC, there's been a few studies of drugs and mTOR inhibitors and other things, but there have been no non-pharmacological intervention studies. So that by that I mean talking treatments, things like CBT or other kind of behavioral interventions. No study in TSC has been done. And that's a concern because we know that these are important interventional approaches in the broader neuropsychiatric literature. So there's a real job, I think, for all of us. Have remote technologies been used? You heard Stacey talk about her eSNORE app. And the short answer is, yes, people have used online surveys and telephone interviews, but nobody's ever used an app. So Stacey's study is truly innovative. And our study in tandem, trying to build things into an app and use it as a data collection tool, is also very novel. Finally, which TAND clusters have been studied? Well, you can see here, you now know about clusters as well. The scholastic cluster and eating and sleeping cluster have had the least. I think overactive impulsive, pretty close, but you can see that this was helpful for us just to see that there's been quite a lot of focus on autism-related cluster work, but relatively little on some of the other clusters that are clearly also important. So we've collected all this information, and now we're in the process, as we speak, of developing a toolkit that will give practical information to mums, dads, people with TSC about each cluster, about what they can seek, and about what they can do themselves at home. The third aim of the study, as I mentioned, is really building consortium, building networking of people. And one of the things we decided was to create a website, and here it is, tandconsortium.org. And we want to make sure that this is a useful tool to families, to clinicians, to practitioners in the global TSC community. And so all those TAND checklists, in fact, we now have about 19 different languages. You can go to the website, you can download them for free, and you can use them. There are lots of movies about TAND, about what it is, how it works. There are some papers that you can download. We try to give free resources, so everything should be freely available on this website. And there's also a little place where families can add their tips about managing TAND so that they can inform us about some of these things that we should look at and consider in future research. There you can see smiling Stacey sitting in the TAND consortium meeting. Important to say that this is not work that Stacey and I and a small group of people are doing. In our consortium, we're almost 25 people from many different countries, I think 10 or 11 countries across the world. And so this is really about a participatory process, and we learn with one another and from one another. You can see we're quite a jolly group, trying to do lots of things. Once again, this is the link to our website. We have a Twitter account, thanks to Stacey as well. And I think, as I said, TAND levels, TAND clusters, and the tandem study. What we're really hoping is that studies like this tandem project will help us find a way to reach many more families, to support many more families. We're also mindful that we need to reach and support more healthcare providers and other care providers, because everyone needs more information about what we can do to support people who live with TAND. And we hope that over the course of this project and beyond, we'll be able to do a lot of these things. With that, I'm going to say thank you, and I hope we have some time for questions and discussions. And thank you all for joining and for staying with us for this very interesting morning of talks.